There is no health without mental health. Psychiatric illnesses are biological illnesses, just like heart disease. If we can't treat ourselves for heart disease, why could we treat ourselves for depression or an anxiety disorder? I believe that this hospital represents a beacon of hope for people with severe and persistent psychiatric illnesses and those who are in crisis. Nurses station?
Yeah, this will be our nurses station here.
The biggest challenge for cities like ours is a widespread lack of access to quality mental health care. Tufts Medicine will be giving us access to something that we have never had here in our community.
So this is what a patient room is going to look like, more or less. We're still waiting for the beds, obviously the mattresses.
Yeah. During the pandemic, we saw a rise in demand for behavioral and mental health care, not only here in the Commonwealth, but also across the country. The vast majority of psychiatric units in the country are in general hospitals. So you have a psychiatric unit that cares for people with medical conditions and psychiatric conditions. But here at this Tufts Medicine Behavioral Health Hospital in Malden, we're going to be a standalone psychiatric hospital, which means the entire focus of the clinical team is all about mental and behavioral health.
So this one will be more for the adults. Yep.
Okay.
Other side is a little bit bigger. That's where they'll have the actual basketball court and things like that on that side. So that'll be more for the kids.
One of the unique features of this hospital will be the development of 6 distinct units, 24 beds per unit, starting with child and adolescent psychiatry, including those with autism spectrum disorders. We're going to have a unit for people with what we call dual diagnosis. These are individuals with substance use disorders who have a co-occurring mental health condition. We're going to have a unit to focus on people with what we call psychotic disorders, people who see things that aren't there or believe things that are not true. We're going to have 2 units to care for older adults, in addition to an adult mood disorders unit for people with severe depression and other conditions.
Tufts Medicine is a true community partner. We all thought, based on past history, that people would be apprehensive about having a behavioral health center in their backyard. I can't recall one time that someone said, not here, not in this area. Once they mentioned that there was going to be a teaching component as part of the project, I think it helped put the project over the top.
We will be training medical students, psychiatry residents, physician's assistants, nurses, nurse practitioners. So we'll have a whole range of disciplines instructed in the care of people with mental and behavioral health conditions to advance their training and to go out into the world, and hopefully some to stay here to continue to work with this patient population. One of our big strategies at Tufts Medicine to really bring the medical world and the psychiatric world together. And then, when that's not enough, we're going to have places like this hospital to help care for the most severely ill people in the time of their life where they need it the most.